Recording in progress.
Hi, everyone. Thank you for joining us today. We're about to begin with our media briefing, so go ahead and click record if you like. We will also have a recording available after the briefing should you need it. And please remember to keep your line muted. We're gathered here today because our hospitals are currently experiencing a surge in COVID-19 patients, putting our facilities at capacity. We wanted to give everyone an opportunity to hear from our physicians and nurses at Cleveland Clinic and university hospitals about what the health systems are experiencing, what we're seeing with the new variant, the importance of vaccines, testing, and offer advice for the upcoming holidays. Our speakers will each make a few brief comments, and then you'll have an opportunity to ask questions. If you have a question in mind already, go ahead and type it into the chat, and we'll answer as many as we can after the speakers are done with their comments. Joining us today are Dr. Daniel Simon, President, Academic and External Affairs, and Chief Scientific Officer at University Hospitals. Dr. Raed Dweik, Chairman of Cleveland Clinic's Respiratory Institute. Dr. Claudia Hoyen, Pediatric Infection Control at UH Rainbow Babies and Children's Hospital and co-director of Infection Control for University Hospitals. Also joining us is Shannon Pangle, a nurse and Cleveland Clinic's main campus chief nursing officer. And also Stephanie Harper, also a registered nurse in the OBGYN area at UH McDonald Hospital for Women. And now we'll kick things off with Dr. Simon. Go ahead, Dr. Simon.
Good morning, and thank you for including me in today's press conference. We need your help now more than ever. There is nothing more important to us than the safe care of our community. What you do now with us will impact how we make it through this pandemic together. Here are the current facts at university hospitals. Our emergency departments are overcrowded. Our caregivers are working overtime and are exhausted. We have more COVID positive patients now in our hospitals than ever before. Currently, there are 394 total hospitalized COVID patients in our system. 19% are in the intensive care unit. Let's talk briefly about testing. Today, we opened a joint University Hospitals and Cleveland Clinic drive-through testing site at the Walker Building. The number of COVID positive tests is the highest since the start of the pandemic. Over 30% are positive. We very much appreciate the Ohio National Guard testing support for today's drive-through testing. Many patients were using the ED and urgent cares for testing purposes that really must be done somewhere else. This will help us offload the emergency rooms to care for patients with strokes and heart attacks, as well as COVID. I'm sure we'll talk about other places to be tested and how now the president is announcing the availability of free at-home COVID tests. Thank you.
Thank you, Dr. Simon. Dr. Dweck, go ahead.
Yes, thank you for having me here. And I want to share my thoughts about what's going on in the COVID pandemic. I want to start by quoting one of my colleagues here in the Respiratory Institute who just recently said, there's a lot of virus out there, and certainly there is. And I'm going to share with you some numbers. Starting with testing, just about 2 weeks ago, the rate of positive tests for those who have symptoms was about 25%. Now it's double at 50%. Those with no symptoms were testing about 20% positive. Now we're at 40%, also double. But most alarming to me is that those who are coming to test for procedures, for example, for a surgery or before a procedure, our testing positivity rate was less than 1%, and now it's approaching 10%, almost 10 times higher. These are very alarming numbers, and no wonder then that our hospitals are filling up with COVID cases. We have more than over 850 patients hospitalized with COVID at the Cleveland Clinic. More than a quarter of them are in the ICUs. So the ICUs fill up after the floors fill up, and that backs up into the emergency department. So I want to echo the comments about the emergency department. It's very important to keep them open, to be able to also to care for non-COVID patients, those with heart attacks and strokes. So it's very critical for us to keep access to the emergency departments. I want to also emphasize that 80% of those hospitalized with COVID have not been vaccinated. In the ICU, the intensive care units, 90% of those hospitalized there are not vaccinated. The few, the 10% or less who are not vaccinated are what we call the vaccinated vulnerable. They are immune system issues like cancer or transplant medications or immune deficiency. On top of all of that, this year, unlike last year, we are seeing also flu and RSV out there, and that really is adding to the burden of infections. So it's very important for us to really try to stay safe by sticking to the basics of masking, social distancing, and getting a vaccine if you have not done so already, or a booster if you have been vaccinated. Thank you.
Thank you, Dr. Dweck. Dr. Hoyen, go ahead.
Again, as my colleagues have said, thank you so much for including us in this press conference for the news here. You know, we're really looking at what the current status is, and both of my colleagues have told you that the numbers are really increasing. As we know, last week within the United States, about 13% of the new cases were Omicron, and now we're, as of last night, it's 73%. It seems to be doubling every 2 to 3 days. And so we're assuming here in Northeast Ohio, we will be at a majority of cases with the new variant, probably shortly after Christmas and in the upcoming weeks. The thing to know about this variant is that it is so much more contagious. When we look at the factors surrounding how contagious these viruses can be, you know, the most contagious virus we think of is measles. That has a factor of about 18. This new variant of COVID-19 has a factor of 15. So it is the second most contagious virus on the planet currently. And so it's just very important for people to understand that we are in a much different position than we actually even were 2 weeks ago. And that we all need to be on guard, because the potential number of people getting infected, even if it turns out that this virus does not cause a severe disease in people, we don't know that right now. That information is still forthcoming. We must assume that it is as serious as Delta. If that's the case, we are going to be overrun. How is this affecting the vaccine efficacy? Again, we're seeing breakthrough cases, but breakthrough cases aren't what we worry about. What we worry about, as our colleagues from the clinic have discussed, are those people who are vaccine vulnerable and those people who are not vaccinated. The vaccines are doing what they can to keep people not only out of the hospital, but out of the ICUs, not intubated, and not suffering fatality from COVID. In terms of our community, it's really imperative that we do what we can. We know that schools are already going remote. We know that our businesses are having to close their doors and scale back. Restaurants are doing what they can to protect their workforce and having takeout only. So again, the more that we can do to keep everybody safe, the better we'll be able to run in our communities. The impact on hospitals, I know you've heard, our ERs are overwhelmed, our workers are exhausted. This has been 22 months of this pandemic, and it is taking a toll. We need to know that when we stress the system like this, we're having to delay procedures. We're delaying surgeries. That translates to delaying diagnoses, and that can affect people's outcome from whatever it is they're suffering from. So it's just imperative that we allow our hospitals to continue to function and to function for all of our patients, not just COVID patients. We know that testing is hard, and as Dr. Simon alluded, we'll be hearing more about free testing. We're thankful for the resources given to us by the National Guard, and it's just really important that we use the appropriate places to be tested. I know within the UH system and the clinic system, many physicians' offices are offering testing, so that is really a place to start, as well as pharmacies and some of these other mass locations. In terms of booster availability, if you haven't been boosted, do it now. If you still have questions about being vaccinated, get in touch with your doctor and see if you can get that information to help you make a decision as to whether or not you need to be vaccinated. Again, it's really our first line and our best defense for all of our communities, but also our hospitals and everyone involved. The other thing is, as we're gathering for the holidays, the timing of this really couldn't have been any worse, to be honest with you. We were already in a Delta surge here in Northeast Ohio, and now we have another surge of a new variant on top of that. So as we are gathering in the next few days and few weeks with friends and family, the smaller we can keep it, the better. Outdoors is always better than indoors. If you are needing to go out and finish your holiday shopping or you're in crowds, please be sure that you are masking. This virus is so much more contagious than any of the other viruses, viral variants of COVID-19. And so it is really spreading like a wildfire across Northeast Ohio. Again, we have things in our toolkit. Let's use them. Let's get vaccinated if we can, get our boosters, use our masks, wash our hands, and socially distance so that we can all get through these next few weeks together and hopefully have a much better 2022.
Thank you, Dr. Hoyen. Shannon Pangle, you're up next.
Thank you so much for the opportunity to speak with the media today. I'm going to focus more on our caregivers. As everyone has pointed out, a very sharp increase in hospital admissions for COVID specifically over the last 2 weeks. Our caregivers are really struggling to keep up with these higher COVID numbers, keeping in mind the PPE burden that we put on our caregivers, having to go into each room and take off that PPE when they come out. We're also struggling to keep up with the higher acuity patients that are coming in. As mentioned earlier, we still are seeing patients come in that are having heart attacks and strokes, and we need to care for those patients as well. And then, of course, the higher ratios that we're pushing our caregivers to. Our ICUs are overwhelmed with patients, and it's not just our medical ICU where we're caring for the majority of our COVID patients. It's our surgical ICU, our neuro ICU, our pediatric ICU. Those numbers are growing day by day. And the last but not least, our cardiac ICUs that are caring for the sickest of the sick, patients that are requiring ECMO, which is essentially a heart-lung machine to oxygenate your blood. It's wearing thin on those caregivers. This time around, the COVID patients are much younger, and so that's impacting our caregivers in different ways. They're our age, they have children, they have mothers and fathers that want to visit and they can't. So our nurses are doing their best to care for all patients, including our COVID patients, as family. They're finding innovative ways to connect virtually. They're working on keepsakes for people to take home for the holidays if their loved ones are going to be in the hospital, as well as those, unfortunately, that pass in our care. Things such as thumbprint ornaments and artwork for children and parents to remember their loved ones by. As everyone has mentioned, our caregivers are physically exhausted, working overtime shifts to fill gaps and care for our patients in an exceptional and safe way. However, the emotional burden that this has put on our caregivers and emotional exhaustion is beginning to show. Again, caring for these patients, you sometimes become their family. You're with them at their darkest hours. You're with them as they take their last breath. All of us want this to be over. All of us want to get back to normal, but please get vaccinated. Wear a mask if you're out in public and stay socially distanced this holiday season. Thank you.
Thank you, Shannon. Stephanie Harper, go ahead.
Hi, thank you guys for including me. I'm on this call mostly to kind of talk about why I was hesitant to get the COVID vaccine and then why I indeed did decide to go ahead and do it. For me personally, I feel like it all happened so fast. I was concerned, is it safe? What are the long-term effects? And then obviously as minorities, we have this mistrust in the medical community and in medicine, and this kind of felt experimental and kind of took us back to our history. So I think for me personally, it was a multitude of things that kind of made me hesitant. Ultimately, I saw the patients coming in sicker. I realized we also don't know the long-term effects of having COVID. So what the data did show for me was that vaccination improved outcomes, and that was important to me. I have 2 children at home. I didn't want to come risk anything for them. So I did indeed decide to get vaccinated. As far as my OB patients, I do work in the ambulatory office and on labor and delivery. So I see it on both sides, from during pregnancy and during labor. We are getting bombarded in the office with COVID calls, COVID symptoms, and on labor and delivery as well. We constantly have patients who are admitted in the ICUs where we are getting pulled from our floor to go monitor patients in the ICUs. The last time I was over there, one of the MICU nurses was like, you guys are going to need your own wing over here because we're just there that often. What we do see is that the majority of our OB patients who are requiring the ICU or who are requiring to be inpatient are unvaccinated. So it's really important for our patients. And we've also seen that COVID is killing our babies. We have moms who are leaving with memory bags instead of their newborns.
Thank you, Stephanie. We're going to begin to take questions now. Just a reminder, if you'd like to submit a question, please type it into the chat and we'll go through them. So the first question we have is from Julie Washington at cleveland.com. Dr. Simon, if you wouldn't mind fielding this one. Why is Cuyahoga County leading U.S. counties in COVID-19 case rates? And why is the virus spreading so quickly in Cuyahoga?
Well, I think that's really a terrific question, and I'll do my best to give a partial answer, and then maybe can turn to others for help. I also looked this morning and was surprised to see, at least at 199 cases per 100,000 patients, we were number 3 behind Tompkins County, New York, and Pike County in Illinois. And I think it has to do with a couple things. One is the weather. People certainly have moved indoors without masking. And that's, I think, a big contribution. The other, of course, is that Ohio trails the country on average in vaccination. If you look at vaccination 12 to 17, the US average is 53%. Ohio is 41%. If you look at 18 to 64, 69% of the US average is fully vaccinated versus 59% in Ohio. So we trail anywhere by 10 to 12% vaccination from the rest of the country. I think what we don't know about, and Dr. Dwake and Dr. Hoyen alluded to, is the importance of boosting in protection from Omicron. We know that nationwide, boosting is only about 30%. And we know that even at 6 months, that's possibly a little bit late. If you look at Pfizer data from Israel and other countries, we start to see the fall off in month 5 and month 6. So if you're waiting to month 7 and 8, it's too late. And so I think what we're really seeing is a combination of people are tired, they're sick of masking and distancing, they're coming indoors for holiday celebrations around Thanksgiving. We have a new variant, as Claudia pointed out, which is highly contagious like measles, and we're under-vaccinated compared to other states in the country. I think that's all contributing to the very, very high rates of 199 per 100,000 that we're seeing now in Cuyahoga County.
I would agree, Dan, and I think as we had discussed, the timing for Northeast Ohio couldn't have been worse. If you think about how the Delta strain traversed our country over the months, we know that it started in the South and then went north. As we know, here in Ohio, we are the North Coast of America, and so we were the last place for Delta to come. So our surge for Delta started much later than some of the other areas in the country. Now, as we are in our Delta surge, we have this new variant, Omicron, on top of that. And so again, it just, for all the reasons you said, the vaccine status, people indoors, the holidays, an ongoing Delta surge, now with this on top of it, as I said, it couldn't have, the timing could not have been worse for Northeast Ohio.
Yeah, and just to add to the vaccine and boosting, I think at least the early study from the CDC, they looked at about 43 cases. The breakthroughs in vaccinated is about 80%, but in those boosted is like 30% of them have been boosted. So that indicates the importance of boosters. And just add to the points that Dr. Simon mentioned is also the masking. I've noticed that our community has really laxed in masking in public. I used to go to the grocery store last year. 90% of the people are masked now, almost like, I'm probably the oddball out masked in a grocery. So I think these are basic things. We know they work. So I encourage everybody to mask indoors as much as they can.
Thanks, Dr. Dwake. We have a question here from Alex Stokes at Fox 8. Dr. Dwake, if you wouldn't mind fielding this one. Do we know where we stand now in the split between Delta and Omicron cases currently?
Yeah, the numbers are changing daily, as was mentioned earlier, and definitely now I think Omicron is the dominant variant in the United States and in Northeast Ohio. We don't analyze every case, but based on the random samples that we do sequencing on, at least 50% of the cases we are seeing now, and it's rising every day, are due to Omicron variants. So it's definitely dominating compared to Delta.
Thanks, Dr. Dwake. We have a question here from WKYC, Isabel Lawrence. Dr. Hoyen, if you could field this one, please. Could you touch upon what we're seeing in pediatric units? It was briefly touched upon that the pediatric ICUs are busy. Are cases up in children? And if so, what can families do to protect them?
Yes, we are absolutely part of this surge. As most of you know, last winter, as we were surging in the adults, we had a little bit of a stopgap in the kids. They were very cloistered. They were at home. They were wearing masks in school. And so they were safe from the strains that were circulating last year. As we know, things are very different. Kids are back in school. Many school districts do not have mask mandates. And so we have absolutely seen that translate into the number of children that we have in the hospital. I can tell you, if you even look back to where we were this summer, and depending on the day, we have 10 to 15 times the number of children admitted to our hospital with COVID than we did this summer. So we are really at a critical point here for pediatrics. Again, we do not want to overwhelm our hospitals, our ERs, our ICUs. Because pediatric care is very specialized, and it's not like we can take children over to the adult side to have them cared for. They need to be in the hands of pediatricians. And if we are filling up our ICUs with COVID cases, which we are, there will not be room for children who are born with a congenital heart defect or a child who is unfortunately in a car accident. So we all need to do our part to ensure the safety of our children. And again, we know how to do that. Vaccinate, mask, distance, and be sure that we're doing all those things to be safe. The other thing is, not only are we seeing more children with acute COVID, but again, in talking to my colleagues, I was just on a call earlier today with the other Ohio children's hospitals. Again, we're starting to see more children with MIS-C. Our long COVID clinic is filled through February. So we are seeing not only the acute effects of COVID with children needing hospitalization and intensive care, but we are seeing those long-term effects in children, which are also taxing our resources. So we all need to do what we can to protect our most vulnerable patients.
Okay, our next question is for Stephanie from Lisa Ryan at WCPN. Stephanie, are you seeing pregnant women who don't want to get the vaccine because they're pregnant? What sort of effect does that have on mother and baby if a pregnant woman gets vaccinated?
Yes, we do have multiple women who call and are questioning, and even in the office, who are still on the fence about getting it while pregnant. All of our providers are strongly recommending vaccination in pregnancy and while breastfeeding in the early postpartum period. I mean, we haven't found anything negative that's been affected as of yet. The benefit outweighs the risk here.
And as from the pediatric standpoint, as we have been looking at the data from this summer in the places that surged ahead of us, like Mississippi, there was a recent article within the last couple of weeks that showed that the rate of stillbirths in women who have COVID is 4 times that of a normal pregnancy. So again, we are starting to see overwhelming evidence that having COVID during pregnancy can not only affect the mother, as Stephanie was alluding to, we have many mothers in ICUs. We know of mothers who have passed from COVID, and we know of babies who have been affected by COVID.
All right, Dr. Simon, if you could field this next question from Ryan Schmeltz. What advantage does the National Guard give you that you otherwise wouldn't have? Are there plans to use the Guard in other capacities in the future?
Well, I think the most important thing that the National Guard does is it allows us to improve our staffing so we can focus on patients in the hospital for both COVID and non-COVID related care at the present time. So manning this drive-through testing, which will start out in the University Circle area, but will extend to an eastern and western location soon, is vitally important to unclog our emergency rooms and our urgent cares. We know about long lines today. This is the first day. Please pre-register at the website for testing. It is free, but you need to pre-register. These patients who are waiting in line today in the drive-through were the patients that were taking up spots in our emergency room and our urgent cares, taking away the time that our doctors could focus on patients who were sick or requiring admission. As more National Guard members become available, they will be deployed in other acute need areas, especially emergency rooms and potentially ICUs, depending on their training background.
Thank you. Our next question is from Emma Henderson at WKYC. Shannon, if you could field this one. Can you please explain what it looks like, sounds like in the COVID units? Speak on personal experience. This pandemic is taking a mental health for you and other healthcare workers.
Yeah, it's definitely sombering to walk through our ICUs and see every single bed space filled with a COVID patient that is intubated and on multiple drips. Our caregivers are so incredibly dedicated to these patients. It's heartwarming actually to talk with them. As I mentioned, they become kind of part of the family. But obviously there's an emotional burden that is placed on our caregivers if things don't move in the right direction, if those patients pass. So it's highly emotional. I think it's also difficult to see all of those caregivers. I mentioned the PPE burden. So think about working on a med-surg unit and you've got 4, 5, 6 patients that you have to get in their room every hour to make sure they're okay. And you have to change your PPE going into every room and coming out of every room. That's also almost an emotional burden on our caregivers because they're used to being able to go into a patient's room and check on them without having to do all those things. I think the other thing that we're seeing on our COVID units and throughout our hospitals is really the impact on some of our support services. So, I mentioned our nurses are functioning with higher ratios than they're accustomed to in order to care for all these patients. But we're also seeing shortages in food service, in EVS, in transportation. So at the bedside, that falls into the nurse's realm of responsibility then. If food doesn't get delivered, then the nurse has to figure out a solution. If lab is not available, then they have to draw blood. On a positive side, the other thing we've seen, and Dr. Dwight might want to comment on this, is incredible amounts of teamwork and caregivers coming together to do their best. In our ICUs, sometimes our patients need to be proned, which basically turn them over on their belly so that they can ventilate their lungs in a more efficient manner. That takes anywhere from 5 to 6 people going into a patient room with full PPE and safely turning an intubated patient that's incredibly unstable. To watch this is simply amazing. And the teamwork of our physicians, our respiratory therapists, our nurses, our physical therapists has just been amazing. So although it's difficult to see every day, it's also can re-energize you, especially as a leader, to go and see these incredible caregivers really going above and beyond for every patient.
Yeah, I agree with Shannon. I think this couple of things that came out of the pandemic that are great for us in healthcare is teamwork, which really was, we always functioned as teams, but I think this pushed us to do even better, and innovation, finding better ways to take care of these patients. But I want to underline the importance of how tired our healthcare workers are despite all of that. From the very beginning, we knew this is going to be a long haul. We told our teams, I was telling my teams every day that this is not a sprint, this is a marathon. But this has now turned out to be multiple marathons. We are our 5th or 6th marathon now, and there's no end in sight. So our teams are beyond exhausted. And I can tell you the last time I was attending in the medical intensive care unit, it just literally breaks my heart every time I have to put somebody on a breathing machine just because it was preventable. They could have got vaccinated and not needed to be in the ICU or go on a breathing machine. They are hesitant even to go on a breathing machine knowing that's going to save their lives. But it literally, you see the entire team just like feeling, just sense of demoralization is like something that's totally preventable that's taking all this work just to respond to it. And again, it's so preventable. I keep repeating that word because it's really, that's the operative word here. A lot of these things that we are seeing in our hospitals are preventable if people got the vaccines or got the boosters. Thank you.
Thank you. We're going to open this next question from Dan at Channel 19 up to the group. He says, we've heard from Dr. Bruce Vanderhoff of patients in the hospital begging for the vaccine and it's too late. Can the doctors or nurses on the call give a personal experience like this?
It's true. I mean, one, it's never too late. We still vaccinate people even when they leave the hospital. You know, when they get better and leave the hospital, we still recommend vaccination. But definitely, it's not going to help them during that hospitalization. So once they get to the point where they're in the ICU needing a breathing machine, a vaccine is not going to work that fast. It's not going to help them. But we still, for those who survive and make it, we recommend that they get vaccinated when they leave the hospital so that they give them even more protection. And I think there's evidence now coming out that those who got infected, when they get vaccinated, they get even better immunity than just infection alone or vaccination alone.
Thanks, Dr. Dweck. Dr. Hoyen, this next question is for you from Mark Gillespie. Has COVID led to an increase in newborn deaths?
Again, we have not done a wholesale study here within Northeast Ohio, but clearly as we look across the country at those groups who have looked at it, there have been an increase in stillbirths. We have had several babies affected with COVID over the last year. And we have certainly, again, we think in our area as well, seen an increase in stillbirth, but we don't have the exact rates because, as we said, our Delta wave started much later than other parts of the country. So if we look to that data in Mississippi, clearly there is a 4 times higher rate of stillbirths. And so, yes, in other parts of the country, and we are assuming here with the cases that we've seen that those rates are higher as well.
Thank you. Dr. Simon, we'll toss this next question to you from Ryan Schmeltz. Do you agree with the information from COVID Act Now that Ohio's COVID risk level has increased? What does severe risk mean, and how can we mitigate it besides getting vaccinated?
Well, if you look at the CDC indicators and threshold for community transmission, we want to be in the blue or the low transmission zone, which is 0 to 9 cases per 100,000 and a positive test rate that's less than 5%. The red zone is a transmission, a burden of cases of greater than 100 per 100,000 and a test rate greater than 10%. And right now, as I mentioned, we're sitting at about 199 cases per 100,000 and a positive test rate, at least at university hospitals, which is running about 30%. And you heard from Dr. Dweck at the Cleveland Clinic, ranging from 30 to 50%. So we are clearly in the highest transmission red zone of community spread right now. And you've heard from Dr. Hoyen, based on the number of infections per index case, that Omicron COVID is now second only to measles in its transmissibility and how contagious it is. So I think we're in a really tough spot right now in Northeast Ohio. I would say the one thing that I would like to call out for a new tool in the toolbox is Pfizer's Paxlovid drug. I think that there's no question that given before day 3 to 5, twice a day for 5 days, we're seeing an 89% reduction in the clinical studies of symptomatic COVID requiring hospitalization or death. That's a game changer. It targets a protease in COVID-19. It is effective against all known variants, including Delta and Omicron. So I know this is now at the FDA and the CDC for an emergency use authorization. We need an oral antiviral that we can give to prevent hospitalizations. There's estimated only 10 million doses available in Q1 of 2022. We need to petition to the FDA, to the CDC, and to Pfizer to ramp up production as soon as possible. that will save our hospitals from being over capacity and overrun with COVID patients. We look forward to that, and we're hopeful that that EUA will take place in the next few weeks.
And Dr. Simon, if you could field this next one as well from Jane Kaufman at the Cleveland Jewish News. Do you know why members of the Orthodox Jewish community may be reluctant to vaccinate, and can you address their concerns?
Yes, that's a very interesting question. I am Jewish and am familiar with pockets of the Orthodox community that have difficulty with vaccination. I should point out, however, that by Jewish law, there is no halachic reason why you shouldn't be vaccinated. And so what I would say, it is a matter of education and peer education. And many of my friends who are Orthodox Jews have been vaccinated, they have been boosted, and they have tried to serve as sources of information and personal communication to provide information about vaccination. So it's very frustrating to me, and it's frustrating to our caregivers because, again, the most effective means of preventing hospitalization, severe disease, and ending up in an intensive care unit is vaccination and boosting. And I think one of the most disappointing things is people don't understand that the mortality rate for COVID when you're in an intensive care unit and intubated exceeds 30 to 50%. And I just have to say, as Dr. Dweck has said, over 90% of the patients in the ICU are not vaccinated. Please vaccinate everybody. Talk to your friends, talk to your family, and just reconsider if you haven't made that decision to vaccinate yet.
Thank you, Dr. Simon. Shannon, we'll send this next question your way. Emma Henderson at WKYC would like to know if we're seeing burnout, people who are quitting because it becomes too much treating COVID patients.
Yes, we are seeing higher levels of burnout. So a couple things have happened since the first COVID and second COVID wave has hit the nursing profession. First and foremost, we're seeing nurses that are leaving the bedside altogether and just going into other professions away from the bedside, which is very sad, very skilled, seasoned caregivers that we're losing. We're also seeing nurses retire at a rate that is much higher than normal. So nurses that may have stayed at the bedside for 3 or 4 more years decided in the midst of COVID, it's time. So we're challenged with that as well, of losing some senior nurses that provided a lot of critical thinking skills to our newer grads as they were starting. And then, as you mentioned, the burnout from our caregivers is very high. We put a lot of programs in place to support them, their wellness, their resilience that we actively have. But as you can imagine, caring for these patients day in and day out, they still are feeling that burden. We also have nurses that are leaving the bedside to take travel assignments. So travel nursing has become incredibly popular as a result of the COVID pandemic. Nurses can travel across the country and make incredible amounts of money in a short period of time. They can also travel locally. So it's interesting, we have UH and Cleveland Clinic on the line because we have nurses that have taken agency jobs from our pediatric ICU and they're working in UH's pediatric ICU, and vice versa. We have an agency nurse from Rainbow Babies and Children's PICU working in our PICU. So that is also becoming very challenging for our caregivers, especially those that are committed to our patients here in our hospital, and maintaining those staffing ratios that I talked about earlier that are so incredibly important to provide safe, effective care to our patients.
Thank you. Another question from Jane Kaufman. Dr. Dweck, if you could take this one. How are the National Guardsmen being deployed at UH and Cleveland Clinic?
Yeah, thank you for asking. And referencing again to what Dr. Simon mentioned earlier, we're mainly using them now for testing. They set up a testing site at the Walker Building, and it's a joint collaboration between UH and the Cleveland Clinic and against the Ohio Department of Health and the National Guard. I have to say that it started today, and really it was overwhelmed immediately. So I was just told that the line has been stopped. They cannot take any more testing today. but they will continue to be open the rest of the week. So, and the key to this is that will relieve the pressure of our emergency rooms and other areas of testing. So I encourage everybody to just go online and sign up if they want to get tested, and just wait for their turn. But definitely this is a great help for us, and we appreciate all the support from the governor and the National Guard in this area.
And as I mentioned in one of my comments, you know, the operational help is also appreciated, and I think there's discussions underway of, you know, how food service could be supported, how some of our ancillary services can be supported as well, because that is a burden on our caregivers, as I mentioned. So we're looking forward to continuing to partner with the National Guard.
Great. Thank you, everybody. That's all the questions we have for today. Thank you all for joining us, and thank you to our physicians and nurses for taking the time out of your busy day to participate today. If you have any additional questions or need details, please contact our PR teams. Also, a recording of this briefing will be made available on our newsroom websites, which are posted on the screen now. Thanks again, and have a safe holiday.